Can you introduce yourself?
I'm Caroline Smiley Diane and I hail from South India. I'm a BSc nurse. I got trained in CMC Vellore and I have 23 years of experience in nursing.
Where did you get your nursing education?
I took up my nursing education in Christian Medical College and Hospital, Vellore, Tamil Nadu, India.
How many years have you been practicing as a nurse and in what areas of nursing?
I've been a nurse since 23 years and I've been working mostly in the medical and surgical units as a staff nurse and in bedside nursing and also in teaching in fundamentals of nursing and supervising students in medical and surgical side.
Can you describe the types of hospitals you worked in?
The first hospital where I worked as a staff nurse was my alma mater, Christian Medical College and Hospital, a 2,500 bedded hospital with multi-specialties and research and also a teaching institution. And then I worked in a school of nursing as a clinical instructor cum theatre OR supervisor. And then I worked as a tutor again in another mission hospital, which is a 100 bedded hospital. And I taught diploma nurses for 3 years. And then I worked in Saudi Arabia as a staff nurse for 3 years again, and mostly in the medical surgical area and also in the emergency unit. And then I worked as a tutor, head nurse, tutor, and also the principal in the same hospital called J. Severin Medical Trust Hospital. And then I went back to Saudi Arabia as a tutor in a College of Health Sciences for females in an area called Abha. And now I'm back in India working as a supervisor in the same hospital which I worked before, J. Severin Medical Trust.
Why did you choose nursing as your profession?
I always thought I was called for it because from the beginning when I was quite young, I was taken up to caring for children, especially because I was the eldest in the family, and also when somebody else in the family needed help, when they were sick or needed, it was me whom they called for. And then when I got chosen for nursing, I thought it's my privilege to serve the people whom I can care for.
What are the most challenging aspects of nursing? Provide us with specific examples from a hospital setting.
Critical thinking and quick identification of a problem and solving the problem with a presence of mind, I think it's the most challenging one in nursing, though there are many other challenges in nursing. For example, I had a patient with a cancer esophagus, post-operative patient who went into a cardiac arrest on the 7th day, and as I was nursing her beside the bed, and it was me who identified it and started the cardiac massage. And by the time the other staff and the ward in charge came into my rescue, and we saved the patient, but though we saved her, because of her disease condition, she passed away after a month, which though is a sad one, but we couldn't help it.
What is most rewarding to you as a nurse? Provide us with specific example.
The satisfaction on the patient when you give care for the patient is the most rewarding one, which I think it's rewarding. It's the greatest reward, of course. I had a patient with colostomy. Exactly, she was not my patient, but when I was working in a surgical unit in general ward, when I was walking around, looking after patients, it was another nurse's patient, but her colostomy dressing wasn't done for a long time. And as I passed, she kept looking at me and followed me with her eyes wherever I went. And then when I went near her, she was really pathetic because her bag was full and it wasn't dressed. So I went and dressed, and also from that time onwards I used to do all the colostomy dressings in that general ward. And the thankfulness and the satisfaction which I see in their eyes was most rewarding, because even though the act of mine was very small, but their satisfaction is great for them.
Describe how you work with doctors in various circumstances. Give specific examples of how you respond to instructions and communicate effectively to doctors.
When I was working in the clinical areas with the doctors, I used to give them the report of the patient of the previous shift, which we have received from the previous staff from the shift, and then give the reports of the results we have already received, and also take the samples of the investigative procedures and send them to the lab and get the reports in time and inform the doctor immediately, and also carry out their orders, whatever it is about the procedures or any medications, and then assist the doctors in procedures and care for the patient and give the full report of that day when we have observed and given care for the patient. There was a time when a patient was on Lasix treatment and her potassium level was 6 milliequivalents per liter. Though she was on Lasix, it was quite high, and she was in a risk of going into arrhythmias if we didn't take action in time. So I immediately informed the doctor, and he came and changed the order, and we rescued the patient in time before she went into arrhythmia.
Describe your work ethic using specific example.
Some of the work ethics are honesty, loyalty, confidentiality, and I think confidentiality is one of the most important ethics which I follow. Once when I was working in Saudi Arabia, a lady who had a pulmonary tuberculosis, was informed to the husband, and the family knew, not all the family knew about it. And the mother-in-law was very particular about knowing what it was, but the patient had warned us not to tell her. And so I had to hide it from her, and like that I held up the confidentiality of the patient.
Have you ever been in charge of a unit? If yes, describe how many staff did you supervise?
Yes, I worked as a head nurse for about 3 years in a hospital, and with 8 staff under me, and also students working under me. And the cleaning sections and all the other paramedical staff also who work along, I've been supervising them also. Then I worked as a supervisor for another 2 years, and then as a principal in the School of Nursing with 6 tutors and 3 clinical instructors under me. There I was doing the administrating work and selecting students, planning the curriculum and setting the syllabus, and also planning the course for the tutors to plan, and then I was guiding them in the teaching and supervising them in the class as well as the teaching area, and also conducting seminars for the nurses in that hospital and the tutors also.
Describe a patient care case from your hospital work that you were a part of and that it made you feel like you performed above and beyond the call of duty.
Yes, I had an incident like that where I had to work above the call of my duty. There was an incident in 1984 where there was a massive train accident where 3 trains crashed one into the other, and there were many casualties which our hospital, CMC Vellore, they went and rescued so many of them. And one of the patients came as an orthopedic patient in my ward, and she had a crushed leg. Both legs were crushed actually, and she had a BK amputation in one leg and an above knee amputation in another leg. And she was in the bed when I was coming for duty on the next day, and her husband, who was admitted in another hospital, he came in search of his wife, and by coincidence he met me and I guided him to her. And when he found that her legs were removed, he was really shocked, because already he had lost his son in front of his eyes when a sharpener came and cut his neck off in front of him, and he was already psychologically out. And when he came to see this, he almost fainted, and we had to give so much of counseling and psychological support before he was stabilized and to accept the condition of his wife. And thank God, after all this treatment, she went back home, and after 2 years, they brought a child to show to us to the hospital, and we were all overjoyed and overwhelmed at this, because the family was united and happy once again.
Would you like to close with any comments to your future employer?
I have served in India as well as in Saudi Arabia, and I've got a good name, and I like to carry on that. And I look forward to an opportunity to work in the United States and practice my skills there.
It was nice talking to you, Carolyn. All the best.
Thank you.